data for facility improvement financing, policy formulation and support, Honorable Speaker, so that at the ministerial level, the minister will be able to formulate policy on how government can be able to collect information, receive and collect data, or even analyze such data as to how government can help the counties to improve on their facilities financing. And Honorable Speaker, of course, Honorable Speaker, amongst all the other provisions which I don't need to go through in the bill, or other responsibilities of the Cabinet Secretary in terms of formulating policies, because we know, Honorable Speaker, that healthcare is a devolved function, and that is why, in recognition of that particular fact, that the healthcare provision is a devolved function under Schedule 4 of our Constitution, most of the policy formulation work is being left to the minister at the national level. But in terms of management of the lower level facilities, that will be done at the facility level, Honorable Speaker. Honorable Speaker, let me not go through all the provisions, but encourage members that this is indeed part of the health care amendment bills, the 4 bills that I mentioned, that will be a game changer in how we manage healthcare facilities in our country and how we actualize universal health coverage to millions of our people who have suffered over the years due to lack of accessible, affordable, and quality health care. That finally, Honorable Speaker, we'll be able to crack what has escaped us for many years in terms of provision of universal health coverage, and towards realization of Article 43.1 on provision of affordable, easily accessible, quality health care for millions of our people. And I want to believe, Honorable Speaker, that all of us will now rise to the occasion, support these bills, this together with the primary health care bill that is also listed as order number 14, Honorable Speaker, together with the 2 other bills that emanated from this House and that have been considered in the Senate, will be that game changer that will make sure that we completely change the architecture of how we manage and provide health care to millions of our people. And Honorable Speaker, as I said, as I moved the other 2 bills, Honorable Speaker, many members of this House, and indeed even in the Senate, and even our governors and MCAs will tell you that one of, other than education, the second is actually the primary burden to millions of our people in our constituencies is the cost of health care. And Honorable Speaker, if we are able to deal with effectively with the cost of health care so that our people are able to access affordable and quality health care at the local level, Honorable Speaker, we will be saving millions of our people from a burden that many families have had to bear with. Many families have been rendered destitute because of healthcare bills and illnesses and sickness in their families. A member of your family falls sick and you simply cannot afford. And Honorable Speaker, even members of parliament, and I know many Kenyans assume members of parliament have all the money to cater for their own healthcare bills, those of their families and their constituents. Honorable Speaker, all these members of parliament here will tell you that every Monday or Friday when they're in their constituencies, the number of fundraisers they are being invited to on account of medical care are unmanageable for them. And members of public, Honorable Speaker, will not even understand that the role of providing health care is now devolved, belongs to the governors and the county governments, and they all walk to offices looking for help. And understandably, Honorable Speaker, Kenyans are desperate for affordable health care, and we cannot afford to finance their health care from our pockets. But by working together collectively as a nation, as leaders, we can be able to enact this kind of laws that will completely change how we manage our healthcare facilities, how we manage our primary health care, how we finance our health care through the social health insurance fund that we approved here the other week, Honorable Speaker, and completely change the architecture of how healthcare is dealt with in this country, and therefore effectively deal with the cost of living. And Honorable Speaker, when you speak about the cost of living, many people assume the cost of living is a matter to do with just food and provision of affordable food. But the cost of healthcare, Honorable Speaker, is a major element in the cost of living. Because if we save Kenyans from the high cost of medical care, Honorable Speaker, they will have higher disposable income available to them to cater for their other needs, be it education or food. And therefore, Honorable Speaker, I beg to move and request members to join us or join me and the drafters of this bill in the Ministry of Health, plus the other